When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Justine McIntyre with the Elias Makos Show again this week. We're talking now about this new bill to try to force doctors to work in the public sector. We've heard about the number of doctors leaving the public sector to work in the private sector. And now Quebec's health minister, Christian Dubé, is set to table a law to force new doctors to practice in the public sector. The new bill will require family doctors and specialist physicians trained in Quebec to practice in the public network during the first 5 years of their career. Here to speak with us about it is our guest, Dr. Laura Sang. She's a family doctor in the Lower Laurentians. Welcome, Laura. Dr. Laura.
Hi. Hello.
Hello. So you yourself work in the public system, is that right?
Yes, I do. I'm in my third year of practice.
Okay. What do you make of this law? When you hear Health Minister Christian Dubé talking about forcing new graduates that are trained in Quebec to work in the public system, does that seem reasonable to you?
I feel like it'd be reasonable depending on how it's implemented. Especially family doctors in this province are already held to some pretty strict practice regulations that we have to practice in a certain region. We have mandated activities for 12 hours a week that we have to do for the government, and that's already a deterrent for a lot of people. So if there was a very sort of punitive way that this would be implemented with more restrictions, I worry it could drive new doctors out of the province altogether, not just into the private sector. But again, depending on how it's rolled out, it could be a viable solution for helping with the doctor shortage.
Is that something that you see happening? Because you talk about it in terms of being a deterrent. Of course, Christian Dubé talks about it in different terms. He talks about it in terms of a social contract. But you, as somebody who's been practicing for 3 years now, is that something that you see more as a deterrent, and is that how it's being discussed among your colleagues?
So the tricky thing is the first 5 years of practice are really, really challenging for a lot of people, because while you have that background in medicine, there's still a lot of learning that happens in those first 2 years. You're learning how to manage a practice, you're setting things up, you're figuring out your schedule, you're figuring out how you want to run things, the whole business aspect of it. And, it's also a critical time where a lot of people are, buying houses, starting families, etc., or may already have done so. So again, trying to be conducive to that and recognizing that, young family doctors are particularly at risk for burnout just because, you're still getting used to a whole bunch of different things. I worry that if there are too many restrictions that are imposed, it might lead to burnout and people leaving. But if it's done in a way that supports family doctors and, supports people in starting their practice, I think it could be really beneficial. I think the real question is why is there so many people avoiding the public system? What are the barriers? I know, for example, a colleague of mine who has 2 young children under the age of 5, was struggling with the mandated activities that she had to do clinic and something else. And she had been in negotiation with the region for months and months and months without being able to get it changed. And what she ended up doing for the years that she was waiting to be able to make that change was she just didn't fulfill one of her obligations and had to deal with a 30% pay cut. I know another colleague that, for health reasons couldn't practice at the volume that was requested, but wanted to create a position for themselves in mental health triage. But despite heavy negotiations with the region and a need for it, there was no way of creating a position in the public sector for that. So this person had no choice but go into the private system to be able to continue to practice medicine.
Okay, so it sounds like, from what you're describing, it sounds like the public system is more rigid than the private system, and that maybe loosening up some of that rigidity could help doctors, could help convince them to stay in the public system.
Exactly. People want to be able to have control over their lives, over their schedules. We want to work hard and we want to serve the population, but not at the expense of our well-being and our ability to practice. And when it comes to self-preservation, that's always what's going to win, because if you're not able to do your job, you can't help anyone. So people are going to do what they need to do to be able to be okay and practice. And I think that that's what's important, is that we need to make sure that the working conditions in the public sector for physicians and all other allied professionals support a healthy work environment and long-term ability to practice.
Okay, I'm going to ask you now to look at the question from the other side, because we also know that the public system right now is not serving the population, with increasing numbers of doctors choosing to leave it and to go into the private system. How do you propose to fix the public system so that it's also serving patients and that it's robust enough to survive? Because right now it's really being called into question.
I know in other provinces, physicians are allowed to work in both the public and private sector. So I think allowing a little bit of flexibility that
to move between the two. Okay.
Not necessarily, or to work in both, because I know I have some colleagues that have an interest, for example, in like cosmetic medicine or other things that aren't necessarily available in the public sector. So, at least they would still be able to keep their practice and they wouldn't have to choose. Being more flexible with the PREMs and what we call the AMPs, those mandated activities that I was talking about, maybe having a slightly reduced load for the first few years of practice, or more flexibility in creating positions in areas where, people want to work and there still is a need, allowing for flexibility with changing these when, life circumstances change, after a maternity leave, after a health issue, etc. And pretty much whatever you can do that would improve the working conditions without penalizing people would make the public system more enticing, and people wouldn't feel the need to go to the private sector. Mm-hmm. They would want to stay.
Dr. Laura Sang, we're speaking with Dr. Laura Sang, a family doctor in the Lower Laurentians. What I'm hearing from you sounds awfully similar to the kind of discourse that I'm hearing. Of course, I come from a different field than you, but in politics, we hear the same thing from young people entering politics, asking for more flexibility, asking for lower working hours, less rigidity, and so on. Do you think that this might also be generational?
I mean, I think there's so many factors that are involved. There could be an element that's generational, but I also think that the population has changed and aged, and there's just a lot more morbidity and complex case management, and the healthcare system hasn't necessarily adapted to reflect that. I know my colleagues, who are nearing retirement, they told me when they started out, they could see 60 patients in a day, because it was mostly healthier people who, were coming in for maybe a pneumonia or whatever, whereas now you have people with multiple cancers, multiple autoimmune diseases, diabetes, hypertension, they're on 30 different medications. It's a lot more challenging to manage, yet we're sort of held to that same volume and same standard, even though the patient load is completely different from what it used to be, coupled with the fact that there's delays in getting laboratories results, imaging, different tests, specialists, all of these things, your flow through the healthcare system, everything is harder, takes longer, and there's just more of it. So I think that is a big contributing factor for people wanting to reduce their hours, just because the work that you're doing is that much more challenging. And I also think that, changing the pay structure to better reflect the work that we do is also something that would be useful, because right now it's, at least for family doctors in clinic, you have to go with a fee-for-service model. There is no salary option, and you get a certain amount if you see X number of patients in a day. So it's very much volume incentivized. Yeah. But, most of my practice is over the age of 70, and it's hard to get certain things done in half an hour and you have to go through the 30 different medications and they're having side effects and that sort of thing.
I can imagine.
So, and then all the paperwork, the SAQ forms, the insurance forms, all of these things take time and take away from patient care, and we need to set time aside to do those. And most family doctors spend about 20% of their week just on these administrative tasks, and that's time that, we can't spend with patients, but is still very demanding.
Minister Dubé has said he also wants to reduce paperwork, so I guess at least there's some awareness about that aspect of the work that you're doing. Dr. Laura Sang, thank you so much for bringing your perspective to this question with us today.
Thank you.